All right, everyone, good evening. So before we begin, I want to ask all of you a very simple question, and all of you need to answer that. How many of you have imagined the moment when you open your MRCS result and see the word pass? If you have imagined that, just let me know, okay? So just take a second and picture that exact picture perfect moment when you will see the result as a pass, right? The relief, the pride, the message that you are going to send to your friends, to your family, the feeling that all the sacrifices were worth it, isn't it? But there is always a but. But here is the reality, isn't it? Every year, thousands of doctors sit for the MRCS OSCE exam, and many of them walk out of the exam hall thinking, I knew the answer, but I couldn't deliver it in the right, proper way it should be, because this MRCS OSCE is not only about knowledge, it is about your performance under the pressure. And tonight, we start building that performance, okay? And you are most welcome with that particular journey that we're going to have together. So first of all, welcome to the IMG Academy MRCS OSCE orientation session. And it truly gives me the immense pleasure to see all of you, so many of the passionate doctors gathered here today with one common dream, which is to achieve the MRCS together, right? But let me say something very, very important. And you need to have that in your mind from the very beginning that MRCS is not about an exam. It's all about our journey, the journey of discipline, sacrifice, resilience, and belief in yourself. Okay. So we are going to start about the orientation. So what we are going to talk about in the orientation is, first of all, we are going to understand about the exam and the formats. What are the stations are there? So we're going to break it down. A little bit of the scoring system, which is not mandatory right now, but yes, it is nice things to know, right? The exam venues and different cost breakdowns. What are the study materials you can use? What are the preparation time that you need, right? What is the specific strategy that you can follow to crack this exam, right? About our course, and also a little bit of Q&A session if you have any queries. But remember, after each of the segment, you can also ask, or you can raise your hand to ask me anything if you have any questions, okay? Remember this. All right, so all of you know about the MRCS exam. This is an intercollegiate MRCS exam, right? So you have given your part A, now you are thinking of giving the OSCE, which is the part B. Okay, this membership exam is gonna conducted by the MRCS England, the Glasgow, the Edinburgh, and the Ireland, right? So in order to sit for the MRCS part B exam, you need to have a certain eligibility criteria, isn't it? So all of the candidates who are going to sit for the part B, they needs to be have the part A passed, right? And then afterwards, you can take the part B, and after the part B, you can go and you can have your GMC registration done, and you can have the potential to come to the UK and work as a doctor in this membership route. Okay, so very essential one. So okay, all the candidates can attempt 4 times, right, after the passing of part A. So now within these 4 times, if you have failed your exam for part B, then you need to resit and then you need to reconsider. But there are certain ways, or there are certain things that you can think, all right, no, your 4 times has chance has passed, all right, but you can also apply to the specific college and they can give you another chance. That is a rare thing, but you don't need to think about that. Our main motto, main goal is to complete this exam in our first attempt. Okay. All right. So let's talk about the station breakdown. About the MRCS OSCE, this objective structured clinical exam, it will consist of total 17 examined stations. Remember the word examined stations. What does it mean by this? So total, you are going to have 19 stations, and I'm going to mention that after a while. Just keep in mind, you will be examined in 17 OSCE stations, okay? Now, each of the station where you are going to be examined, that will be consisting of 9 minutes. It will be 9 minutes long. Okay, there are 1 minute to read the task, that is the instructions that will be posted over the door that you're going to enter inside of a station. Okay. And there will be additional 1 minute to for moving in between the stations. When your one station is done, you're going to move from station A to station B, and you will have that 1 minute for the movement. The entire exam, it will take about approximately 3.5 hours. Sometimes it could be a little bit longer as well. Okay. So you are gonna rotate in a clockwise manner inside of your exam, right? And it could be like sometimes it is starting with the knowledge, sometimes it's gonna starting with the skill part, sometimes it will be only the knowledge, sometimes it will be only with the skills, or sometimes it will be a like haphazard things. So you will get to know about those things little by little after a while. Okay, so let me start with the stations breakdown a little bit more. So we have two broad headings. So you can think of your right arm and left arm or something like that. Okay, so in the very beginning, we have this knowledge part, and also we have the skill part. Okay, now let's break down the knowledge part a little bit more. So as a whole, we have 8 stations we are going to face for the knowledge. So in the knowledge, what are those? We are going to cover anatomy, will consist of 3 stations. We are going to cover the applied surgical science and the critical care, ASSCC, 3 stations. And the pathology, we're going to have 2 stations. Okay. And in the skill part, we are going to cover a total of 9 stations, among which in that, we have the clinical examination stations that are 3 stations, history taking, 2 stations, procedural skills, 2 stations, and the communication, 2 stations. So total of 9 stations. Okay. All right. So 8 stations in the knowledge, 9 stations in the skill part, total of 17 stations. So far, if you have any queries, if you have anything to mention, you can ask. No problem. Go ahead. I will give you 15 seconds maybe on that. Anyone has any queries, any questions, please? Please feel free to talk. Try to start to communicate from right now, because in case of the OSCE, it's all about communication. It's not about like, okay, I'm a complete knowledgeable person, but if you cannot deliver, if you cannot perform in case of your exam day, like nothing will happen, right? So start communicate. You could ask me the most silliest questions as well. Don't worry. Any question, Dr. Tazin?
Not right now.
Not right now. Perfect. All right. Okay, fine. So this is about the stations a little bit. Okay. Now let's talk about the scoring system a little bit. Okay. So about the scoring system, we have, as you can see, as a broad area, broad context area, we have the knowledge and also we have the skill part, isn't it? Okay. So as I have said, we have the anatomy. How many stations? 1, 2, 3. So here we are gonna see, and the examiner is gonna see whether we have the proper clinical knowledge and its application, whether we know it or not. Based on that, we're going to have a total of 20 marks from anatomy, including also in case of the pathology, we are going to follow the same pattern. They're going to check whether we have the proper clinical knowledge and the application, and we can have our 20 marks of that as well. So our first 5 stations done, 3 of the anatomy and 2 of pathology. Now, when it comes for the critical care, that is the applied surgical science and the critical care, we have a little bit of deviations on those. Okay, so they're going to check on the clinical knowledge and application for 12 marks. They will see whether we are clinically and technically skilled or not. For that, they're going to give us 4 marks. And for the professionalism, they're going to give us 4 marks. Now, all of you will say, all right, what does it mean actually by the professionalism, right? So let me give you an idea. Suppose they're going to give you one scenario. Okay, the patient had this and that and all that. So how you are going to approach toward this patient? What do you think the patient's diagnosis is? What are the proper investigations you want to carry out, right? So many of you is gonna mention, all right, yeah, I'm gonna run all of the investigations and all that stuff, da 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 da, and I'm gonna do the management and all that stuff. So all of you is gonna mention the same manner. All of you are gonna mention the same thing, isn't it? But the problem is they want to hear the most important, relevant investigation and the most important management options in the very first place, such as suppose the patient is being diagnosed with the pulmonary embolism. Okay, And as we know, the most important investigation, the gold standard is to do the CTPA, right? So they're going to check whether you are going to mention the CTPA as the investigation for PE in the very first place, or no, you are mentioning, okay, I'm going to do ABG, chest X-ray, ECGs, and all that stuff in the very first place. So it will be mentioned in that way. Okay, just same example. Suppose one patient has been suffering from cancer. Okay, and they ask you, okay, how you're going to manage this patient. So maybe it's a end stage cancer and the patient doesn't have any options to go for the definitive treatment. So you're going to mention, yeah, maybe I'm going to do the palliative treatment in case of this patient. But remember, each of the patient who is going to have the cancer, the most important one to manage the patient is go for the multidisciplinary team approach, right? So those fine words, those few things that you must mention to show that you are professional enough to have the proper awareness and the judgment, and you have the proper organizing capabilities for planning for the patient's proper safety. Once they will understand, okay, yeah, this candidate understood everything and the patient is safe for this doctor, and you will pass. Okay, it's very easy, very simple. Okay, that's why we are here. That's why I will mention and I will teach each and everything what you are going to mention and what you are not going to mention and what you are going to mention, but in the last phase. Okay, that's how you're going to become a more professional one. Okay, I hope that works a little bit. Okay, next thing, next broad area is the skill part. Okay, let's divide this into a little bit of communication skills and the clinical and the procedural skills. Okay, communication has two different ones, right? As I have mentioned, four categories in case of the skills. One was the clinical examination, procedural skills, communication, and the history taking. Now, in case of the communication skills, we have two important stations. One is communication with the patient's relatives or the patient themselves. Okay, so communication with a person. And another one is the communication with our colleague. Okay. Now, when we are going to communicate with the person, what they're going to check whether we have a proper clinical knowledge and application. Among for that, they're going to give us 4 mark. For proper communication, they're going to give us 12 mark. It's a lot, isn't it? And also for the professionalism, they're going to give us 4 mark. Okay. About the communication, in case of this, they're giving us 12. Why? Because it's purely communication, isn't it? And you need to remember when you're going to talk with the patient or relatives, they are not a doctor, they're not a medical person. So you need to talk in medical terms. Is it? Everyone? Are you going to talk in medical terms? Come on, are you following me or not? I'm just talking.
Yes, sir.
Yes,
Are you,
sir.
are you sure? When you're going to talk with a relatives or a patient, are you going to talk in a medical terms?
No, we
No.
No,
will
sir,
use
not medical terms.
layman term.
Layman language.
Exactly. Yeah, you guys are following now. So they will check on those things and they're going to provide you 12 marks on that. Okay. All right. So let's talk about the communication with the colleague. All right. So it's almost following the same pattern for the clinical knowledge and its application for the proper communication with our colleague. And also here, as we are talking with the medical person to medical person, so they're going to check whether we are more professional on that or not. Okay. About the history taking 1 or 2 stations, they are going to check we're going to have 4 marks in the clinical knowledge and its application. Here, we're going to check whether we are going to follow all the patterns, all the steps wisely or not, right? And also for the communication and also for the professionalism, they're going to give us some marks. Okay. Next, for the clinical examination, as we have 3, they are going to check whether we are clinically sound or not. 4 marks for that for the clinical and technical skills, how we are examining the patient, right? Whether we are doing that in an appropriate way or not. For that, they will provide us 8. And for the communication with the patient, because there will be a patient, 4 marks. And for the professionalism, 4 marks. Okay. Next, for the procedural skills, there are 2 ways. One is the procedural skills over the patient. There will be a patient. So the same pattern for the clinical examination as well. And there is a proper technical one. So here there is no patient, nothing to be done, such as like the OT listing, right? Such as the not tying stations. There is no actual patients will be there. So in that case, they will check our clinical knowledge and its application. And for the clinical and the technical skills, they will give us 12 marks. So this is a little bit of breakdown in a brief about the scoring system. Any questions, please?
No, sir.
No, okay. So this is one of our candidates' result. Just check. In case of the knowledge, he got 139 out of 160, and the passing mark was 110. And in a skill part, he got 153 out of 180, and the passing score was 115. So he passed. So what does it mean by this? You need to pass in each of the categories separately. That means in case of the knowledge, you need to pass, and also in case of the skills, you need to pass. Suppose you got 153 in skills, but you got 109 here in the knowledge. So your result will be fail. Okay? Everyone got the idea about the scoring system a little bit? I hope yes. Come on, guys, you need to give me a feedback. All right. So let's think of the our first knowledge station, which is anatomy. As I have said, in case of the anatomy, you're gonna have three stations, isn't it? So in case of the anatomy, what we are gonna do? Okay, you are gonna start. Suppose this is your station, and you are gonna standing in front of a room. So on the door there is a stem written. There is a injury to the patient's forearm. Right, so your consultant thought to ask you few related questions about the forearm. So you will enter into the station and you will see there are lots of images are there. Okay, so what are the images looks like? Mostly like kind of this one. Okay, so they are going to ask you few related questions. Okay, can you identify number 3, 13? Can you identify number 12, 11, number 5? Right, can you identify this structure, please? What is the function of this structure? So your questions will follow like this. And of course, roughly you are going to have 20 questions. And for each question, there will be a separate markings, right? And then there are multiple images you can have in case of the anatomy. That's one part. Other thing is you can have some radiological images, or nowadays in a recent context, they are providing surface markings. So for the surface marking, in case of the anatomy as well, you can have a patient inside of the room and they can ask you, all right, can you show that specific thing? Suppose the coracoid process, can you do the surface marking of the coracoid process? Or can you do the surface marking of the parotid gland over this patient, right? So sometimes now the exam is changing, so they can give you that kind of a scenario, and you should be able to do that. To have the ease, we have done one compiled surface marking for entire exams for all of the anatomy sessions, all of the stations. So we have compiled and we have uploaded that into the drive as well. So once you will be into the course, you can have the access for that. Okay. All the new questions, everything is included there. Okay. So this is about the anatomy station. This is very easy if you know those things. And it will be getting very depressing if you don't know the thing, right? All right, so how do I teach the anatomy? I normally used to teach the anatomy by the 3D modelings, right? How does the 3D modeling works? Let me just show you one thing. So about the 3D modeling, I just want to show you that, like, in case of a 3D models, what we are going to do is we are going to show you these kinds of image, and we are going to particularly start with the specific things that the examiner is wants to know from you, right? So I'm going to build you the proper concepts, ins and outs about the anatomy, because the anatomy is very volatile and you will forget the anatomy very easily. That's why my goal is to give you the proper feedbacks and proper basics inside of your head. And once you will go with those things, with the new question patterns and the new images, trust me, you will have the high score in the anatomy, inshallah. Okay. Any questions about the anatomy, please? Come on, guys. Don't have any questions? Am I so good or you guys are so smart? I think you guys are so smart. All right, let's move on for the next one. About the critical care. inside of a critical care station, what you're going to have, what you're expecting. So when you are going to enter into the station, after reading the stem will be looking like kind of a this. Suppose that there is a person who had a 50 years old female patient diagnosed with the Crohn's disease. So the patient underwent the ileocecal resection on the heart postoperative day 4. There was an anastomotic leakage after the functioning ileostomy was done, and the image is this one. All right. So based on this, what is your diagnosis recently? What are the further investigations you want to do? What are the management options do you have? And few repetitive questions they are going to ask you in this particular station. Within the station, what does it look like? I have tried to imitate the same scenario with the AI. So you will enter and there will be a table. One examiner will be sitting in front of there. You are going to sit, and the same stem will be inside of the table as well. And you can see there will be a lots of images like the radiological images, CT scan, the maybe like ABGs and all that stuff will be there. So you need to check on those things a little bit as well. You need to keep your eyes open for those things. Okay. So in these particular stations, they will be going through very easy things. And as I had almost 8 years experience in the critical care, along with my surgical career, so I personally I love to teach the critical care. And um, I will not give you the shortcut for the exam, obviously not, because I want you to do a little bit of hard work for understanding of the critical care. Because once you will understand this, you're going to love it, right? And also, if you're going to join with the IMG, I'm going to transform you from from like a doctor to a like MRCS grade doctor. So you need to transform yourself according to that as well. So it's all about mindset. So about the critical care, you are going to face again the three stations, and the three stations will be as simple as like this. Any questions about the critical care, please?
No, sir.
No questions. Okay, perfect. Next is patho. Patho. Isn't it very eye like? Isn't it this image is paining in your eyes because of the color? Don't you think? Don't you think I should change the color of this image? It is hurting your eyes a little bit, isn't it? Give me your feedback, guys. Come on. Is it so or not?
Yes, yes, a
No?
little bit shiny, glowy.
Yeah, yeah. So why I have kept it like this? Because the pathology, I don't like it. And trust me, you're not gonna like it as well. This is very rude subject. Okay. And in every exams, you're gonna face 10% of the new questions in case of the patho. So the patho stations will be divided into general pathology and the cancer pathology, okay, or neoplasm stations that will be separate. But the format is the same because it's a knowledge stations, right? So you will enter with the STEM, and afterwards you will see the examiner is sitting and they will be asking you a few different questions and you're going to give them the answers, okay? And also mostly here you will be asked with the very basic pathology questions, and in case of the neoplasms, they will be showing some histopath reports and all that stuff. You need to go through that. But don't worry, it's very short, right? You're going to give the short answers during the exam, and it's very much achievable if you go through the way I'm gonna mention and whether I'm gonna guide you. Okay, so it's very easy and it's not that much tough, but it's irritating that you need to go through this. Okay, so the system is the same. Any questions for the patho, guys?
No, sir.
No. Okay, all right. Let's move on. All right, so let's talk about the skill. So we have covered the knowledge. Now tell me, if you're following me properly, tell me how many stations were there in the knowledge? Dr. Jahangir, Dr. Thazin, Dr. Ilora?
Eight.
8 stations. What are those? Can you break down those a little bit?
Anatomy, pathology, and critical.
Right. How many stations in anatomy, pathology, and critical care, to be specific?
Anatomy, pathology, and critical care.
Perfect. Okay. So you get the idea about the knowledge part. Let's talk about the skill part a little bit. Okay. About the communication. And as I said in the beginning of the station, that there are total of 19 stations, but you will be examined on how many? 17 stations, isn't it? So what exactly I meant for that, right? So for each of the communication stations, before you're gonna start, there is one preparatory station, okay? Now, what does it mean by the preparatory station? So you will enter into a room, and inside of the room, you will see there is a table, there is some case file, there is some paper, pencil will be there. So you will enter and you are going to read those case file. The case files are the patient's case file, okay? And you are going to have some of the information notes into your paper, and you're going to take this paper only, leave the case file as it is there, okay? And once you will take the paper, and you will move on for the next station, you are going to face the communication proper station. Suppose the communication with person, the communication with the patient or the relatives. How does it look like? So once you are going to enter into the station, you will see there are two examiner and one patient is sitting, and you are also going to sit in front of the patients or the patient relative. Sorry about the image. You should be looking towards the patient or the patient's relatives. Okay. Now, why there are two examiner? Any idea, guys?
One for checking the layman term, and
Exactly.
the other
Brilliant.
checking the knowledge.
Brilliant, Dr. Thazin. Perfect. So one examiner is going to check whether you are medically correct, and another examiner is a layman. He's not a doctor, right? So he's going to check whether you are using the layman terms with the patient or not. Okay. So you will have the same exact case file within this particular station as well, and you're going to talk with the person in front of you. There are certain rules, there are certain ways, there are certain things that you should follow. That's what I'm going to do in the classes. The proper guidelines will be given, but like, let me say something for you. Okay, so the main skills, what you should do is you need to show empathy. There is no doubt about that. In case of the skill part, whenever there is a patient, you need to show the empathy. Okay. You need to have a proper communication with the person. So you have been given 9 minutes, isn't it? So what do you think? How much time you should utilize in case of the communication station, guys?
6 minutes.
No, in case of the communication, you're going to use the total 9 minutes. You're going to
Total
communicate with the
9 minutes.
person. Okay. There is nothing, no breakdown of the Q&A session with the examiner, nothing. So you're going to entirely use your 9 minutes, but it is suitable to use 8 minutes, 20 to 30 seconds, right? Because you don't have any clock inside of the examiner exam room, right? The station. So you don't have the idea. So you need to practice according to that. Okay. There are certain manners that you should avoid. Okay, like you cannot have the medical jargon, you cannot like have like looking here and there. You need to have a proper eye contact with whom you're talking to, right? Also you need to listen to the persons very, very nicely. Okay, that's a effective communication. I'm going to mention a lots of more tricks then during the proper guideline session, inshallah. Okay, next, after the preparatory station, you can also have another station is the phone call station, right? So what does the phone call stations look like? So you will enter into a station. So you will see there is no one, right? There is only, maybe if you are going to have your exam in UK, you will see there is only a phone, right? And there is, you are gonna take the phone and you are gonna start to talk, or there is a screen and there is the Skype call ongoing and you're gonna talk with the opposite person, but there is no one physically present inside of the room. There will be a same case file will be present inside of that, okay? And there will be some other things like some like ABG or chest X-ray, some radiological images will be there, some reports will be there, right? Some labs will be there. Everything could be there. So you need to keep your eyes open on that. So it's a completely phone call station, right? It's a audio call that will be happening. So it's like it's a human nature that sometimes we will fabricate some things. Maybe the information is not given inside of the case file, and the consultant is asking me some questions, but which we don't know. So don't try to lie in those situations, because If there is no one, so there is a high tendency of the human nature that you might lie, but don't do that. They well known about the case file. They know each and everything. All right. So if you're gonna lie, you're gonna fail. But if you're gonna say, "Oh, sorry, I'm really sorry that I didn't look for that. I'm gonna take a look and I will mention to you once again," they'll be more than happy to that. Okay. So it's about the communication phone call station. Remember this. Any question about the communication, please?
Since the preparatory stations will be in the same rooms or a different room?
Different room. There will be two preparatory stations. Each is designed for different station. One preparatory station for communication with a person, and there is another preparatory station for communication phone call. Am I clear?
Okay. Yes.
Okay.
Time distribution for the communication, just like
Same, 9
how many?
minutes. 9 minutes. 1 minute to read your stem, 9 minutes for your performance, 1 minute to move from one station to another station. Same time amount for the preparatory station. 1 minute to read the stem, 1 minute to prepare yourself within the preparatory station, and 1 minute to move from your preparatory station to the examiner station.
So how we can go through the file within 1 minute?
Within 1 minute? No, you have 9 minutes.
Okay, firstly we have to read this question stem, right?
Right. So assume this is the room, okay? And this is the door. Over the door, there is a stem, and you are standing here, okay? So you are gonna read this stem for 1 minute. After the 1 minute, you will enter inside of this station, and you are having 9 minutes to read the case file and prepare your station. Okay. Once the 9 minute is over, you are gonna move out from this station, and you're gonna have 1 minute to move from this station, and you're gonna enter into this particular station. Okay. But before you're gonna start this station as well, again, there is a room, there is a door, and there is a stem. Again, you're gonna read the same stem for 1 minute. And after the 1 minute is passed, you will enter inside of this room and 9 minutes will start. Okay. And you're going to be examined for 9 minutes, and then you're going to move out. And for that, you're going to have 1 minute, and you're going to stand in front of the next station. Now clear, Dr. Jahangir?
Yes, sir.
Perfect. Any other questions? No? Okay. Next one is the clinical examination. About the clinical examination is very, very important. Okay. There are certain examinations. There are a total of 24 stations that we need to go through for the clinical examination, including the abdominal examination, CVS examination, hernia stations, thyroid stations, swelling stations, critical care, the CVS stations. There are lots of things, right? So you need to examine the patient. Based on that, you need to make your presentation, and then followed by some questions. How does it look like? Inside of the station, you will see there is one examiner will be there. There will be one patient, and you are going to be examining the patient. Okay, here about the time for this station is a little bit different. Okay, so how much time you have total for 9 minutes, isn't it? Now, this 9 minutes will be divided as 6 minutes and 3 minutes. This 6 minutes is for your clinical examination only. After you are done with your clinical examination, you will be given 3 minutes for your presentation plus question and answer section. Am I clear about the timing? Everyone, yes, no? Any
No, sir.
questions? Okay. All right. So
Time
suppose,
distribution.
yeah, it's clear, isn't it?
No, sir, not clear.
Okay,
Clinical
let me
examination
explain.
distribution.
Let me explain once again. So as a whole, how much time we have in general? 11 minutes total, isn't it? 11 minutes here, 1 minute for reading the stem, correct? 9 minutes for our performance, and 1 minute for moving from one station to another station. So far clear, Dr. Jahangir?
Yes, sir.
Okay, now let's divide this 9 minutes for the clinical examination. These 9 minutes will be divided into 6 minutes and 3 minutes. What you're going to do with the 6 minutes, you are going to examine over the patient. Okay, after the 6 minutes, they will say your 6 minutes is over. Then what you need to do, you need to present your case, and they are going to ask you some questions. Let me give you one easy example. Okay, so you are entering into the station, okay, and you are reading the stem for 1 minute. Then, after you enter into the station, you will see this patient is here, and you have been asked to do the abdominal examination over this patient. So you are doing your abdominal examination for 6 minutes, and once your abdominal examination is done for the 6 minutes, you are gonna present your examination towards the examiner, and the examiner is asked you the question, and you're gonna give the answer for those questions for 3 minutes. And afterwards, once the station is finished, you're going to move out from this station and you're going to stand for the next station. And that is the 1 minute. This is the overall 11 minutes time. Now, is it clear, Dr. Jahangir?
Yes, sir.
Everyone, any questions, please? Any questions about the clinical examination, please? Because this is very important. There are certain rules, what you can do, what you cannot do. There are
Sir,
certain. Yes, please, Dr. Ahmed.
yes, yes. Are the 6 minutes able to me to finish all the exam if the station is about مثلا like thyroid,
Yes,
there are them examination need more time.
yes.
I need I
You
need to be
are able
rushed.
to finish.
Formal.
You will be able to finish all the stations they're going to provide, because those are tested and managed by thousands of candidates in the past, and they have passed within that 6 minutes. You'll be able to do that, but you need to understand the concept, and that's why I'm here, right? That's why I will mention what exactly you're going to do stepwise, right? And what you're going to follow stepwise, so that it will be more efficient for you to understand. Because everything for the clinical skill part, I have made the 10-step approach for the clinical examination, for the procedural skills, for the history taking, for the communication. If you can follow those, it will be efficient for you, and also you can finish those stations within your time, and you will have the highest score, inshallah. Okay, so there is no doubt about that. Any other queries, please? No? Okay, all right. Let's talk about the history taking. About the history taking, it's almost similar to the
I have
clinical
one
exam.
question.
Sure, Dr. Jahangir.
Is this mandatory to maintain the sequel during the clinical examination,
Yes,
like
yes.
inspection, palpation?
Yes. But it's not like if you forget and you cannot do the further examination over the patient, it's not like that. But it is wise to follow those steps, because the British, they really like the algorithm, right? And they don't want to have the haphazard one. So if you do some, like suppose you're doing the general examination, all of a sudden you're doing the special test and you're coming back for the systemic examination. So that's a little bit of haphazard thing. They don't like that. That means like you don't know those things properly, right? And you're not confident enough. Okay.
Okay, sir.
All right. About the history taking, we're going to have two stations for the history taking, right? In case of this, the time management is almost the same as the clinical examination. So the 9 minutes will be divided into 6 minutes and 3 minutes. Over the 6 minutes, you're gonna have the question and answer session with the patient, and afterwards, you're gonna have 3 minutes for the presentation and the Q&A session with the examiner, right? So how does it look like? You will enter into the station, you will see there are two examiners once again. One is the medical examiner and the one is the layman examiner. all right, who's going to check whether you are using the layman terms with the patient, and you are going to talk with the patient only in the first 6 minutes. You will take a complete history from this person over the 6 minutes, and after your 6 minutes is done, you will present your case, and the examiner is going to ask you few questions within that 3 minutes, and your station will be done. There are a total of 21 stations that you need to face, and that we're going to do each station, and I'm going to mention all the specific things, all the 10 steps approach that you're going to follow. And it's very easy in case of the history taking if you follow my protocols, and it will be much more easier to remember as well. So I think, yeah, you can have this very, very easily to be covered. Okay. Any questions, please, for the history taking? And also there are some like important protocols that you need to show. You need to have, like, just for example, you need to show the empathy, of course. You need to have a proper eye contact, just like the communication, because it's a communication station as well, right? And certain other rules, like if the patient is mentioning about the pain, you need to offer them some painkillers, you need to say sorry and all that stuff. As for the empathies, there are lots of things that you need to show on this history taking as well. Any further questions? No?
No, sir.
Okay, all right. We have the procedural skills. We are going to face the 2 stations for the procedural skills, and we have 6 to 8 stations depending upon where you're going to give your exam, right? So those are very, very easy stations, and all of you can perform those. Like suppose abscess drainage, suturing, knot tying, catheterization, right? OT listing. These are very, very easy stations to perform. But the problem is you need to understand their stepwise approach. So that's why the 10-step approach is very, very important in case of the procedural skills as well. Like for an example, what we do in our countries is like we can use the sharp and we are just leaving that over the like table or somewhere, right? You cannot do that during the exam. You need to throw your shards instantly after you're going to use your shards into the specific area, right? So these are simple rules that you need to follow in case of the procedural skills. You need to show them the technical proficiencies, of course. Yes, you need to show them the aseptic techniques and the sterility. Also, you need to communicating with the person as well. And also during this process, you're going to have total of 9 minutes. There is no division of the time like the clinical examination and the history taking. You will be utilizing the entire 9 minutes for your performance here. And meanwhile, while you are doing your procedure, the examiner will keep asking questions to you. You need to give them answers. So you need to do the multitasking in that way, right? So you're performing and also you're giving some answers. Also, the patient is going to ask you some questions as well. You need to give them the proper answers on that. You need to give them the proper stepwise direction, the guidelines, whenever it is necessary, right? So it's a little bit of mind game that you need to do those things sideways. So it's a little bit crucial if you don't do the practice in a proper way. Okay, that's why like the videos that I'm going to provide you as a workshop videos that I have made by myself for the clinical examination and the procedural skills as a stepwise approach is very, very crucial and important to ace on your exam. Okay, any questions from the procedural skills, guys? No questions? Okay, all right. So how much we have covered? We have covered the knowledge. We have covered the skills part, isn't it? So Dr. Tazin, tell me, how many stations are there in the skills total?
Will be 9 stations.
Tell me the breakdown.
And for examinations will be 3, and history taking will be 2, and procedure will be 4 stations. Oh no, is it?
Repeat.
So history taking will be 4 stations, and the procedure will be 2.
So clinical examination, 3. History taking, 2.
4.
Procedural skills, 2. Communication, 2. Okay. So total of 9 stations. And also we have 2 preparatory stations for our communication. Okay. So these are the total of stations you can remember as well. Okay, all right. So let's think about the study materials. To be honest, there are lots of study materials out there, isn't it? But we tried to keep our IMG notes as a unique one. Why? Because you don't need to have everything for the exam, right? So I have pick and choose what is exactly is required for you to go for your exam. Okay. And we are also updating this with a lots of new images, the exam images, also new stations, and also I have added the surface markings. Also, that has been compiled, and also there's a IMG Magic Notes specially designed for the clinical examination, because sometimes just before your exam you need to have something to see, um, like just for your revision. So at a glance everything will be there, right? So we try to keep these things as a unique one for the study medal, so you don't need to think of different medals. Okay, now I need to go for that, I need to go for this. No, sometimes in the previous, like when I have given my exam, when the notes has not been made, right? So I need to go through this material and that material and this material. So I need to grab and pick and choose whichever is good for the history taking. I was searching for that. I was starting from there. Which are good for the anatomy, I was searching from there, right? So what I have done is I have made this into a unique one just for one, and you don't need to go for any other thing. To my utmost honesty, I can mention, if you follow this material and the classes, you will have a 90% of the things will be the similar about the exam, but 10% of the questions will be always be the new question. So those questions you cannot have if you're going to read the hundreds of textbooks, even though. Why? Because MRCS, they wants to maintain their integrity as a standard exam from all over the world, right? So they're not gonna give you the appropriate all of the questions like upfront to you. Okay, here everything is like pretty old. No, they're gonna give you a new questions in every exam. So the 10% of the questions will be the new. Okay, so this is the material that you can follow blindly for the 90% of the questions, and it will be common, and which is more than enough to pass your exam. Because why? Because the passing rate and the percentage is only 70 percentile, right? So if you know the 90%, you will be like having a lots of marks on that. Okay. Next, preparation time. All right. So I have mentioned 4 to 6 months on average is a suitable time for the candidates. Why? Like, see, each person is different, isn't it? Each of the candidates are different, and like someone can remember the things very easily, and someone needs to go through those multiple times. So it entirely depends. But for 4 to 6 months is the optimum time to, like, prepare yourself and pass in the first attempt. If you're going to plan for more than 6 months, you will have some problem, because when you have in your mind, okay, my exam is in after 8 months or like after a year. So in your human mind, like you will think, okay, no, I have a lots of time, right? So let me just like go through to play and watch a movie and do all that stuff, right? So you will not have a proper mindset. I need you to have a proper mindset to fix your mind. No, this is my exam. I want to give my exam and I want to pass this exam in the first attempt. Why? Because it's an expensive exam. It's a nerve-wracking exam. You don't need to face this again and again. It's a very stressful exam. This is an exam that you have never faced in your life before. Trust me. So you need to have a proper guideline, and you need to have a proper vision with the motivation, of course, to pass this exam. And I need you to have a proper mindset on that and set your time for 4 to 6 months. That is enough. That's my promise if you follow everything. Okay. Next is about the expenses. Okay, it will vary for the registration of the like exam. It entirely depends where you're going to give your exam. It will be around like 1100 till sometimes it goes up till 1300 as well. You can join the courses. It varies from 250 to 500. Sometimes you can go for the hands-on. It will be around like 200 pounds, right? So it depends like what you're gonna do. It will entirely depends on you. What is the expenses? Even like if you're gonna go to abroad, like suppose you're from Bangladesh, right? And you want to give your exam in Malaysia. So you need to book your tickets, you need to book your hotel, you need to have your expenses for food, for transportation. So it will adds up a little bit of more money, right? So it's an expensive exam, trust me. So you need to think very, very wisely on that. Okay. So about our course, like lots of your previous candidates have passed from our courses from all over the world. So we are doing it right now once again, and I'll be there to help you, and we'll be taking all the classes as live class, all the mocks as a live mocks, and also after each of the classes, after each of the mocks, I will be uploading those into the Google Drive so that you can have the access for that. So now I'm going to show you what exactly you're going to have once you're going to have the course. Okay, so that it will be a little bit easier for you to understand how to navigate within the drive. So let me just share that screen a little bit. Sorry for this. Okay, let me know whether you can see the screen, everyone. Yes?
Yes.
Okay. So once you're gonna join the IMG course, you will be given this drive access, right? How to navigate. So this is the new course, June 26. This new folder I have made. So where I will be posting the class, sorry, recordings here and the mock recordings here. Okay. So this is your new course folder. Okay. This is the new course folder that is starting from tomorrow. So all the new classes will be uploaded here and all the new mocks recordings will be uploaded here in this folder, right? Always remember to follow the new course videos, because in the new course videos, I always give you the new images, new questions, and new things. So you need to join the live sessions and also the recordings you need to follow for that. Okay, what else you're gonna have in this course? So here you can see the past course, right? So if you go into the past course, you will see again the class recordings and the mock recordings, which have we already finished earlier, right? Few days back. So you can have those access for all of those classes, right? Like the anatomy, you have all the classes. Like for the critical care, I have divided all the stations and given as a organized one. All the classes will be there. So you can go and revise for yourself from there. Also, all the mock recordings are also be provided. Okay, so I didn't give you only the one past course. I also given you 2, 3 past courses. Maybe I'm going to delete this one because it is completely outdated, so it doesn't mean anything to you. So I'm gonna delete this one. So I'm going to keep this to one, maybe the past course October 25 and the past course February 26, which is just finished. So I'm going to keep this two for your reference. If you want to go for that, yeah, you can. And also all the new classes will be uploaded here. Okay. Next, your study materials, right? The anatomy, critical care, clinical examination, communication, everything is here. So all the study materials, you can have the access from here. So you can check, right? So in case of the anatomy, I have given new surface anatomy compiled version of the PDF, right? So, and after each of the classes, this will be updated. Like tomorrow we have the spine and upper limb class, right? So after this, about the spine and upper limb, all the new images will be uploaded here, updated, right? All the new questions will be updated. So you can have those things from here as well. Okay. Next thing is after the study materials, you have the routine for the new cycle. If you can see, I have uploaded here. So you can see the course calendar. I really like to follow this calendar. So it's a little bit easier for us to like navigate through, right? So we will be following this course calendar for our next couple of months. And if there is any changes, I will be also mentioning that beforehand, before the class timing, so that you can understand and we can have those things. About the calendar, how we are going to navigate, just first of all, you need to follow the codes. The bluish one is the live class one. The little bit of orange one is the live mock sessions, and the green one where you're gonna do your practice. And sometimes I give different colors, like there's Eid, so we have the vacation, it's a pink color, and also there are some recordings that you need to see that these are some purple color things. So always go with the codes, and you will understand what about this. And also I have written down the contents as like details. What are the things we're gonna cover in this month? And also what are those as follows. You can just read and you will understand. These are very, very self-explanatory things. Okay. Afterwards, what else? What else I can show you? Yes, that's it almost. And as I was also talking about the hybrid workshop video, so if you can see the clinical examination, so all of this are made by myself, right? While I was taking the classes, and I was showing like all of this examination as a stepwise videos, right? So you can just check and you can imitate those things by yourself, okay? And yeah, I think that's it. That's it for now. Also, yes, IMG recall. So I'm been always updating those things, and you can have the IMG recalls for past, like exams. I'll be uploading those files here as well in the IMG recalls. Okay, yeah. So far, any questions, please?
Sir, can you show again the calendar,
Can I show the
navigation
calendar
of the
once
calendar?
again? Yeah, definitely. Why not? Okay, so see, this is the March, right? The March calendar. So the content type is anatomy. Mostly in this month, we're going to cover the anatomy. In the course, if you can see, the blue color is a live class. That means the anatomy spine, right? We're going to have as a live class tomorrow. It's on the Friday, right? And then we're going to have the practice for 2 days, right? There is no class. Will be there. You are going to practice by yourself. And on 16, we have again the live class as the blue color for the anatomy upper limb. And then again, you're going to have 1 day for your practice. And then on 18, which is on Wednesday, we have the mock session for the spine and upper limb, which we have finished. Okay, so this is in the orange color. So this is now like by this you're going to follow the dates, and you can have this calendar downloaded from the drive, and you can just print it and you can have it for yourself. Clear, Dr. Jahangir?
Yes, sir.
Okay, perfect. All right, so this is about it. And also, like, as I mentioned about the course, like I try to teach each and everything a little bit of like, in a basic manner so that you can have those things in your mind, right? So I don't appreciate that you can memorize things. I don't like it. I need you to understand the basic concept so that you can remember this more, right? And also, while I will be teaching, I will be also mentioning how you can remember those things very easily, and how to approach this study materials, and how you can guide through yourself. Okay. About the hybrid workshop, I have already mentioned I will be like, giving you all the videos, and already been there, whoever is the participants are there, you will have those access for stepwise approach. About the hands-on, right? So currently we are only be able to do the hands-on in UK and Bangladesh, right? So if you wish to join the hands-on, yeah, definitely you can. There are like hundreds of candidates has joined, and they were so happy. They like, they really like those 4 days, and we are the only one we just give you the 4 days of hands-on instead of 2 days or 3 days, which is not like enough to understand all of the skills. Definitely not. So we don't want to do in that way. I like in the hands-on also, I want to take the proper exam from all of you so that I can see how you're going to perform in the real exam, right? So it's a very like the pressure cooker situation you will be put, and which is particularly requirements to you to go for your real exam, right? So there is a like for the past 3 times for the hands-on, that we have conducted, I'm blissful to say that like that was 100% success on the hands-on. Like whoever joined, they never failed in the skill part. That's amazing. So like, yeah, if you want to join the hands-on, yeah, you can, but it is not mandatory. As I'm also saying, I'm being honest with you, this is not mandatory to join the hands-on. If you follow the course only, there are hundreds and hundreds of candidates who never joined the hands-on in the past, right? So you don't need to join into the hands-on, definitely not. It's a business for all of the other courses, but I do this for you guys as a 4 days. So if you want to participate, yeah, you can, but this is not mandatory. Once again, I'm saying this. All right, so about the quick revision course, the quick revision mock sessions that is being taken just before 1.5 months prior to your exam, right? If you wish to join, you can, and you will be having all the stations that is covering. So now on, you will be taking those mocks for your just before your exam, right? So with a very few amount of payments, like for the IMG candidates, there'll be a huge discount on that. So you can join the QRC groups just to like participate once again. But it doesn't mean that you cannot participate into the course. Of course, once you join, until you pass your exam, you can have the live mocks, you can have the live classes as many times as you can join. You can join. There is no issues. But above that, if you want to join the QRC, which is exam directed, you can join these QRCs as well just before your exam. Okay. All right. So now, if you have any queries, this is where we are gonna end. If you have any queries, you can ask me. If you want to give me any suggestions, you can give me. It's now your time. This is all about that I wanted to mention. Anyone?
Sir, are there any videos for like communication stations? Or
Sorry, didn't understand. Sorry.
for like, are there any videos like we can refer to for communication stations?
You don't need to. You don't need to. Just you
Okay.
need to follow the instructions that I will be mentioning, and that will be enough.
Okay. Okay, sir. Thank you.
Any other questions? Anyone? No. All right. Before we end today's orientation session, I want you to remember one thing, all of you who are present and who will be watching the videos as well. Every MRCS holder you see today was once exactly where you are right now. Confused, nervous, unsure if they could pass this exam or not, right? But the difference between those who succeed and those who don't is very simple. They did not quite, right? They showed up every day, they practiced very well, they improved themselves, and they trusted the process. And slowly, step by step, they reached the finish line. Months from now, the day you see pass next to your MRCS result, right? The moment will be unforgettable. You will be remembered the late nights of study, the stress before the mocks I'll be taking, the self-doubt you're having right now, and the determination that pushed you forward. And I do promise you, it will all be worth it. Okay. At this IMG Academy, our job is very, very simple. We walk this journey with you until you succeed. Okay. But remember, the success ultimately depends on your commitment, your discipline, and your belief in yourself. So from tonight onwards, I want you to start thinking like a future MRCS surgeon. Be consistent, be confident, and never underestimate what you are capable of achieving. Okay? Because when we are going to do the next MRCS success story, I will be sitting maybe in the same session with you. Okay. So thank you everyone for joining for today's session. And yeah, most welcome for having me. All right. So good night, everyone. And thank you so much for joining.